Hi, everyone. My name is Nick Szoko, and I'm one of the first-year adolescent medicine fellows here at Children's. And on behalf of my team, I'm grateful for the opportunity to speak a little bit today about our project, Anti-Racist Curriculum Implementation for Pediatric Residents. So we know that Black, Latinx, and Native American communities have limited representation in medicine. In addition, the impact of racism on child and adolescent health outcomes is well understood. That said, few interventions exist to date that really target the development of anti-racist skills and behaviors in pediatric trainees. And so with that need in mind, we sought to implement and evaluate a longitudinal anti-racist curriculum among pediatric residents in our program. So we implemented this curriculum during the existing educational time over 7 noon conference sessions throughout the year. And these sessions incorporated both lecture and discussion-based formats. We administered pre and post surveys before and after the curriculum to assess 4 key outcomes as you see listed here. Awareness, which incorporated 5 different content domains that I'll go over, knowledge, clinical skills, and advocacy behaviors. We conducted paired testing to compare these measures before and after the curriculum among residents who completed pre and post surveys. So reviewing our results, you see that 37 residents completed pre and post surveys, and the mean age among these residents was 28. Most were in their first or second year of training, and the majority identified as female. In terms of the racial ethnic makeup, most of our residents were non-Hispanic white, and the average number of sessions attended was 3 out of a max of 7. About a third had some form of prior anti-racist training, and unfortunately, a significant number had prior experiences of race-based discrimination in the workplace. Table 2 shows the comparison of measures before and after our curriculum. And so you can see that within awareness, certain topic areas showed significant improvements with our curriculum, including schools, health and healthcare, employment, and housing and transportation. We also saw a modest improvement in knowledge scores with our curriculum, as well as self-reported trauma-sensitive clinical skills. Individual advocacy behaviors, which included things such as reading about topics related to race and racism, also saw a modest improvement with our curriculum. We also wanted to assess feasibility and acceptability. And so you can see that the majority of residents felt this material was useful for their practice and relevant. And most also thought it should be mandatory to learn this material for all clinical care providers. So we demonstrate here that unfortunately many pediatric residents have experienced race-based discrimination in the workplace, and that the longitudinal anti-racist curriculum that we introduced showed improvements in awareness, knowledge, as well as self-reported clinical skills and advocacy behaviors related to anti-racism. This curriculum is also very feasible and acceptable by incorporating it into existing educational time. And our findings really highlight the importance of additional advocacy opportunities to further build these skills in residents.